She walked into the exam room with her spine straight, her voice steady, and her medical records in hand. Proof, she thought, of the years she spent serving her country and the pain that came with it. But what happened next was something no one prepared her for. The examiner barely looked at her file, asked a few quick questions, scribbled some notes, and sent her on her way. Weeks later, she opened a letter from the VA. Denied. Not enough evidence. Not severe enough. As if the pain she carried every day, hidden, quiet, and constant, was just an exaggeration. This isn't just her story. It's the story of countless veterans, especially women, whose service doesn't fit neatly into the boxes the VA wants checked. Pain that doesn't show up on scans. Symptoms that don't come with scars. And claims that get denied not because they're false, but because the system refuses to see them. If you're preparing for a VA compensation and pension CNP exam, there's one hard truth you need to know. The outcome doesn't just depend on what's in your file. It depends on what you say, how you say it, and whether you're ready to answer 6 questions that can change everything. The VA system isn't just looking for honesty. It's looking for precision, consistency, and proof. If you're not ready, your pain might be overlooked too. In this video, we're going to walk through 6 critical questions you absolutely must be prepared to answer before your exam. They're not always asked directly, but they're what the VA is really listening for. Stick with me until the end, because one of these questions is so often misunderstood, it alone can cost you your claim. And if you know someone facing the system alone, share this with them. They deserve to be seen, heard, and believed. Let's get started. The first question you must be prepared to answer, though it may not be asked directly, is this: how does this condition impact your daily life? At first glance, it seems straightforward, but most people answer the wrong way. They minimize. They say things like, "I'm managing," or "it's not too bad." They've been trained to tough it out, especially veterans, especially women veterans, who've often had to prove themselves twice as hard in a system that doubted them from day one. But here's what the VA is actually listening for: specifics. Not how brave you are, not how you've learned to live with it, but how it limits you. What can't you do anymore? Will you avoid? How has it changed your routines, your relationships, your ability to work, sleep, move, or even just feel normal? Take Maria, for example, a former Air Force mechanic. Her back pain started during deployment, but worsened over the years. At her CNP exam, she told the examiner she had some stiffness and that she still gets around okay. What she didn't say, that she hadn't been able to sleep through the night in over a year, that she needed help carrying groceries, that she avoided driving long distances because the pain made it unsafe, that she stopped volunteering at the local animal shelter, something she loved, because bending and lifting were unbearable, because she downplayed it. The examiner downplayed it too. Her claim? Denied. When you answer this question, don't just talk about pain in general terms. Describe what a typical bad day looks like. Talk about how it affects your ability to function, physically, emotionally, socially. Use real examples. I can't stand longer than 15 minutes without needing to sit down. I have to take breaks every time I vacuum or do dishes. I avoid family gatherings because sitting for long periods makes the pain worse. That level of detail is what turns your experience from a vague complaint into documented, undeniable evidence. This isn't about exaggerating. It's about being honest, fully, clearly, and unapologetically. Because if you don't explain how your condition disrupts your life, the VA will assume it doesn't. And that's a mistake you can't afford. The second question you must be ready to answer is one that often catches veterans off guard. When did this start? Now, you might think that's an easy one. You might even have a date in mind. But here's where it gets tricky. The VA isn't just asking about your memory. They're checking your timeline. They're comparing what you say to what's in your medical records, your service records, and your past claims. And if things don't line up, even slightly, it can hurt your credibility more than you realize. For women veterans especially, this question comes with layers, because many didn't report symptoms during service. Why? Because they didn't want to seem weak, or because there was no one to listen, or because the culture made it clear, complain, and you're seen as a problem, not a patient. So now, years later, when that pain has worsened or that anxiety has become harder to manage, it's easy to feel uncertain about when it officially started. But here's what matters: consistency. You don't have to remember the exact day or even the exact month, but your answer needs to make sense in context. It started during my deployment in 2012 is more credible than a while ago. Saying, I didn't seek care right away because I was worried about my reputation, is more powerful than pretending it wasn't there at all. Take Jasmine, for example, a former Navy corpsman. She started experiencing migraines while serving overseas, but she didn't report them until a year after returning home. At her CMP exam, she hesitated. She wasn't sure what year began. She guessed, and the examiner flagged it as inconsistent. Her claim stalled an appeal for nearly 2 years because of one shaky answer. So here's the advice: trace it back in your mind. Think about when the symptoms first disrupted your duties or changed how you operated. If you didn't report it at the time, say so and explain why. Did you fear retaliation? Did you think it would go away? The truth with context is far more persuasive than a perfect-sounding lie, because this question isn't just about your memory, it's about your credibility. And if you're not ready for it, the VA will assume your condition didn't again when you say it did. And that could be the difference between approval and another painful denial. The third question they'll ask sounds simple, but it holds enormous weight. How does this condition affect your daily life? Now, most veterans hear this and give general answers. It hurts, or it's tough sometimes. But vague statements don't move the needle. The VA isn't just looking for complaints. They're looking for consequences. They want to know how your condition changes your ability to live, work, and function. If you don't spell out clearly, they'll assume it doesn't impact you enough to matter. Here's what most people don't realize. This question isn't about sympathy. It's about evidence. They're not asking how bad it feels in theory. They're asking how it shapes your daily reality. Can you sleep through the night? Are you missing work? Does it stop you from driving, shopping, cooking, parenting, or simply getting out of bed? Let's go deeper. If you say you have chronic knee pain, don't stop there. Say, I can't walk more than 10 minutes without swelling. I avoid stairs. I have to sit on the edge of my bed every morning and massage the joint before I can move. If you're dealing with PTSD, go beyond saying, I have nightmares. Say, I wake up drenched in sweat for nights a week. I avoid crowds. I sit with my back to the wall at every restaurant. I haven't gone to a movie theater in 5 years. These are the details the VA needs, and the ones most veterans don't think to share. For women veterans especially, this question can be tough, because many are used to minimizing their pain, to pushing through, to functioning in spite of it. But if you downplay what you live with every day, you're doing the VA's job for them. You're giving them a reason to say your condition isn't disabling. Take Alicia, for example. She served in the Army and developed severe joint pain after a training injury. At her first exam, she simply said, "It gets stiff." That's it. Claim denied. At her second review, she brought notes. How she couldn't lift her toddler, how she needed help carrying groceries, how driving more than 30 minutes caused swelling. This time, the examiner took it seriously. Her rating changed from 0% to 40%. So don't hold back. Don't assume they'll get it. They won't, unless you spell it out. When they ask how your condition affects your life, that's your moment. Be specific. Be honest. Be bold. Because this is where the difference between denial and compensation is often decided. And if you leave this answer too soft, the system will assume you're fine. The fourth question they'll press you on is deceptively simple. When did your symptoms start? It might seem like just a date on the calendar, but your answer can make or break your entire claim. Because the VA isn't just trying to understand your condition, they're trying to draw a straight line between your current pain and your time in service. If that connection isn't clear, or if your story has gaps, they'll use it to deny your claim before you've even had a chance to explain. Here's the trap most veterans fall into. They give a rough estimate. Say something vague like, a few years ago. Or even worse, they mention a date that's after their discharge. That one mistake is all it takes for the VA to say, this isn't service-connected, And just like that, your file ends up in the not our problem pile. But here's what the VA won't tell you. Your memory and your language matter. Let's say you were discharged in 2016 and started noticing back pain in 2017. That sounds like it's post-service. But what if you clarify that the pain actually started during your last deployment, but you didn't report it because you didn't want to look weak? That changes everything. Suddenly, it's not a new problem. It's a delayed report of an old one. This happens all the time, especially to women veterans who were trained, directly or indirectly, not to speak up. Maybe you were told the pain was normal. Maybe you believed reporting symptoms would hurt your career. Or maybe you did report it, but the military didn't document it. That doesn't mean it didn't happen. But if you don't explain the why the symptoms were real, why they were connected to your service, and why they might not appear in your records, the VA will assume you're fabricating it. And here's another critical point. Consistency matters. If your CMP exam answer doesn't match what's in your original claim, or your doctor's note, or your buddy letter, you create doubt. The moment the VA spots inconsistency, they lean toward denial, not because they think you're lying, but because their system runs on paperwork, not empathy. So here's what to do. Think carefully before your exam. Revisit your timeline. Ask yourself, when did you first notice the issue? What were you doing? Where were you stationed? Who was around? Did you mention it to anyone, even casually? Was it written down? If not, why? Write it out. Make it real. Because if you can connect the dots clearly and confidently, you give the examiner what they need to connect your condition to your service. This isn't about perfect memory. It's about making your truth undeniable. If your pain started during a ruck march, say it. If the trauma began after a specific event, explain it. Don't be vague, don't guess, and don't undersell, because that one question, when did it start, isn't small. It's the foundation of everything. And if your answer isn't locked in, your claim will never stand. The fifth question they'll throw at you is one that seems harmless, but it's actually a test. How does this condition affect your daily life? On the surface, it sounds like casual conversation. But behind the clipboard, they're measuring every word you say, because this is where they decide whether your pain is just an inconvenience or something that deserves compensation. Here's the truth. Most veterans downplay it. They say things like, it's manageable, or I just push through, because that's what we're taught. Don't complain. Don't show weakness. But in the VA system, being tough can cost you, because if you minimize your struggles, even unintentionally, the VA will too. If you say your knee pain comes and goes, they'll mark it as mild. If you say you have trouble sleeping sometimes, they'll assume it's not that serious. And if you say it doesn't stop me, they'll conclude it doesn't impact your functioning. And that means no rating or a much lower one than you deserve. So here's the shift you need to make. Don't answer like a soldier. Answer like someone who's trying to survive in a system that's already stacked against them. Be honest, brutally honest, about the ways your condition affects you. Does your back pain stop you from picking up your kids? Say it. Does your anxiety make it impossible to go to the grocery store? Spell it out. Does your depression keep you in bed for half the day? Even when you want to get up, they need to hear that. And don't just name the symptom. Connect it to real consequences. It's not just that your hand hurts. It's that you can't hold tools anymore. It's not just ringing in your ears. It's that you can't concentrate, and it's hurting your job performance. You're not exaggerating, you're explaining. And if you don't explain it clearly, the VA will assume it's not that bad. Also, don't assume they know. You might think it's obvious that PTSD affects your sleep, or that migraines make it impossible to focus. But unless you say it in specific terms, they can't document it. And if it's not documented, it doesn't exist. So before the exam, sit down and make a list. Start with this question. What have I stopped doing because of this condition? What have you changed, avoided, or lost? Social activities? Physical ability? Work capacity? Emotional health? These are the answers that matter. Not how strong you've been, but how much this has cost you. Because this question isn't small talk. It's how they decide whether your pain deserves recognition, or whether you'll be told once again that it's not bad enough. So don't hold back. You've already lived through the hard part. Now it's time to make sure they understand just how hard it's been. The sixth and final question is the one that catches most veterans off guard. Not because it's hard, but because it seems so routine. When did your symptoms start? Simple, right? But your answer here can make or break your entire claim. Why? Because the VA uses this timeline to decide two things: whether your condition is service-connected and when your benefits should start. If your answer doesn't line up with your service records, or if you're too vague, they'll use it as an excuse to deny or delay your compensation. Here's what most people get wrong. They think, "I don't remember exactly," is a safe answer. Or they say, "a few years ago," hoping that's close enough. But vague dates leave room for doubt. And doubt in the VA system almost always works against you. Let's say your back pain started after a fall during deployment in 2009, but you didn't report it until years later. If you tell the examiner, "I guess it started around 2015, you just gave them permission to deny the connection to service. You've disconnected your claim from your military experience, and they'll say, "No evidence it began during active duty." That one slip, just a few words, can erase years of medical history in their eyes. That's why this question requires clarity and confidence. You don't need the exact date, but you do need a solid timeline. Think in terms of milestones. It started after I returned from Afghanistan in 2009. I first noticed symptoms during field training in Fort Benning. The pain's been there since the Humvee accident in late 2011. These aren't guesses, they're memory anchors. And the more specific you are, the harder it is for them to dismiss you. And if your symptoms started during service, but you didn't report them until later, say that. Don't lie or invent records, but explain the gap. Say, "I didn't report it because I was trying to tough it out," or "I didn't want to seem weak." That honesty tells a story the VA needs to hear, and it's a story they often recognize. Because here's the truth, a lot of veterans don't speak up right away. They ignore the pain. They don't want to look soft. They wait until the symptoms become unbearable. And by then, the paperwork's long gone. The VA knows this happens. But if you don't give them a clear timeline, they'll pretend it doesn't. So before your exam, take the time to go back. Write down when you first noticed the symptoms. Link it to specific moments. Think about what you were doing, where you were, what changed after, and if it's been constant ever since. Say that too. This isn't about creating a perfect record. It's about giving them a clear, credible path that leads directly back to your time in uniform. Because when you say, "I don't remember," they hear, "There's no proof." But when you say, "It started after this happened and it's never gone away," they hear something else entirely: credibility. And in a system where too many claims are rejected over lack of evidence, your memory might just be the evidence that gets you through. The truth is, the CNP exam isn't just a routine checkup. It's often the single biggest moment that decides whether a veteran gets the benefits they've earned or walks away empty-handed. And the hardest part? Most veterans walk into that room unprepared, not because they didn't care, but because no one ever told them what to expect. They served with honor, lived through real pain, and then sat in front of someone who had the power to question whether that pain was real enough. If that sounds unfair, it's because it is. But knowing the right questions and having the right answers gives you back some of that control. So, if you've made it this far, you're already ahead of the curve. You now know the 6 questions that matter most, and more importantly, why your answers need to be honest, consistent, and specific. Don't let rushed words or vague timelines be the reason your claim gets delayed or denied. Every detail you share is a piece of your truth, and that truth deserves to be heard, believed, and properly compensated. If this video helped you feel even a little more prepared for your CNP exam, please take a second to comment below. Just drop a "ready" to let us know you're walking into that exam with your head high and your facts straight. And if you haven't subscribed yet, now's the time. Hit the subscribe button and turn on notifications so you never miss another video that could change the outcome of your claim. We make this content because veterans like you deserve clarity, not confusion. Respect, not rejection. And every time you share these videos or leave a comment, you're helping someone else in the same fight feel less alone. So thank you Thank you for your service. And thank you for showing up for yourself now. We'll see you in the next video. And until then, remember, your story matters, and we're here to help you tell it right.